Heart disease gets a lot of attention in February, but it's important to talk about now and all year long. Dr. Vasundhara Muthu is a cardiologist at the University of Maryland, Baltimore, Washington Medical Center, and she joins us now with more. Thank you so much for being here.
Thank you for having me, Elsa.
So tell me a little bit about heart disease. I think we hear about it, but a lot of times we don't understand exactly what it is.
So heart disease is a full spectrum and it can involve, multiple diseases. I think the ones that we most commonly talk about, or I guess that people usually want to talk about, are coronary artery disease, which in simple terms is a blockage of the blood vessels supplying the heart, which results in heart attacks and can cause other problems such as congestive heart failure, which is the other big problem, which is basically that the heart is not working well, and hence there's a buildup of fluid in the lungs which causes shortness of breath, among other symptoms. And then there can be heart rhythm problems such as atrial fibrillation, which is a growing problem, as the population ages. So those are some of the more common problems, but there are many others that would fit into the category of heart disease.
So what are some of the symptoms that we should be on the lookout for?
So the common symptoms, of course, would include any chest discomfort, and it is important to realize that especially women may have atypical symptoms with a heart attack. So may they not just have chest pain in the front of the chest, they may have back pain or shoulder discomfort or some pain in the neck or the jaw or in their left arm. Okay. Symptoms of shortness of breath, feeling dizzy or faint or actually passing out. Or not feeling well, feeling for a diabetic, even subtle symptoms such as not feeling well or feeling that something bad is going to happen may signal some kind of heart disease.
Are there any ages where this starts to come up more?
So of course heart disease increases as the population ages and as people grow older, but interestingly enough the incidence of heart disease is actually increasing among younger people. Even people in the age group of 30 to 60 years of age, which previously, especially among women, was thought of as low risk for heart disease. So pretty much everyone, especially those with a family history of any kind of heart problems, should be aware about it and should discuss it with their doctor.
So how is it actually diagnosed?
So there can be many different ways to diagnose it, many different tests. So the initial assessment would again begin with your physician, and then there can be many tests. The most commonly used ones are the electrocardiogram or the EKG, which is a summation of the electrical activity of the heart. It's a quick and simple test, can be done in a couple of minutes, but can give a lot of useful information.
Okay.
And then there can be an echocardiogram, which is pretty much an ultrasound, which looks at the heart and its structure and the functioning of the valves and the different chambers of the heart. And then there would be a stress test, which is where people would either walk on a treadmill or get some kind of medication to stress their heart, and either get their EKG alone monitored or get some pictures of the heart to look at blood flow to different areas of the heart, and that would be one of the common tests we would use to look for the coronary artery disease or blockages.
And then if they find something, it can be treated.
It can most certainly be treated. There are lots of good medications with good results, so some people may not even need any procedures done.
Okay.
And then of course the procedures for heart disease have gotten very sophisticated and very easy as well. So pretty much you could walk into the hospital, get a procedure called as a cardiac catheterization, get the disease fixed and walk out the next day.
Well, I'm happy that you're here to tell us this, because I think a lot of times our viewers, and myself included, will hear heart disease and it just seems so scary or insurmountable.
Sure.
But I know that we can go to you, honestly, into the hospital for help. So how can people go and make an appointment with you or with the hospital? What should they do?
So they can just call the number. So the number to the hospital is the 410-787-4000 number, and then of course the number to the office for appointments in the office is 410-768-0919.
Perfect. Thank you so much, Doctor, for being here. Appreciate it. And you can also check out the website as well. Dr. Muthu, thank you for being here.
Thank
and
you
we'll be
for having
right
us.
back with more Midday Maryland right after this. Stay tuned.